Hello, Assalamualaikum. So today I will be explaining about autism spectrum disorder. So let's start with definitions. So autism spectrum disorder or ASD or previously also we call as a pervasive developmental disorder PDD is actually constitute a broad class of conditions that reflect a range of deficits, of which autism is the most well documented form. So, is autism is actually the lack of communication skill and social interactions, resulting in isolations of the children. Alright, so it is a characterized by severe impairment and also complex impairments. So this one in terms of reciprocal social interactions, communication skills, and also by the presence of stereotypical behavior, interests, and activities. So based on the autism children, it have the severe impairment, also complex impairments in terms of reciprocal social interactions, communication skills, and by the presence of stereotypical behavior, interests, and activities. Okay. So causes of autism, actually there was no known definite mechanisms, but they have several theories. The first one, impairment of happened during the sculpting of wiring of the brain during the utero phase during pregnancy. And then the second one, based on neuroimaging studies, so it shows difference in cell density and also reduced neuro size in area critical to the trilogy of social behavioral communication disorder. So it have difference in cell density and also reduced neuro size in autism children. So another one, the last one, these individuals exhibit abnormal cortical convolution. Specifically, some of their brain sulci appear to be deeper and slightly out of place. So the features is actually the unusual combinations of three things: sensory, communications, and also behavior. So these three, in long term, it will have significant negative effects on a child because to participate in home, school, or community activities. Autism often coexists with neuropsychiatric disorder, including seizures, ADHD, affective disorder, anxiety disorder, obsessive compulsive disorder, and also Tourette syndrome. And this behavior characteristic is the behavior characteristic of autism is very important because it can be characterized by four subclusters of disturbance. So we have to carefully observe these four things: disturbance in social interactions, disturbance in communications, disturbance in behavior, and also disturbance of sensory and perceptual processing and associate impairment. So let's start with disturbance in social interaction. So it's actually affect the child ability to establish meaningful relationship with people and inanimate objects. So it also have a poor or deviant eye contact. This is the characteristic of the social interactions we can see from the child. He or she may have poor or deviant eye contact, failure to develop peer relationship, delayed or inappropriate facial expressions, apparent aversions to physical contact, lack of social reciprocity, delayed or absent anticipatory response to being picked up, and also lack of spontaneous seeking of another to share enjoyment. So this thing we could see in autism child. So because of the social, they have disturbance in social interactions, there will be lack of eye contact, and also they can fail to develop the peer relationship because of lack of the social interaction. And then based on what I said earlier. Next one is disturbance in communication. So it may be taught as a continuum from mild to severe. From the mild end, actually the normal language accompanied by slight articulations or tonal deficits only. But on the severe end, it is a complete lack of speech. Or also it can have much of the speech of the children with autism is repetitive or echolalic. So this classic echolalia consists of parrot-like repetitions or phrase immediately after the child has been exposed to them. But in delayed or deferred echolalia consists of repetition of phrases at a later times. So other types of speech and language problems include syntax. So other motility problems include head rolling, banging, body rocking, and also swaying, toe walking, and it can have the inability to perform two motor act at the same time. So it will be very difficult for multitasking two motor act at the same time. So it will be hard for autism people. Next one, I will talk about the disturbance in behavior. So, intolerance of deviations from routine. So, resistance to any types of change and patterns of behavior that are best categorized as stereotypical, preservative, and lacking in representational or pretend play. So, it have very rigid routine. So, they will not tolerate with a change in their routine, and can cause the tantrum. So next one is bizarre attachment to unusual objects develop. So it means have intense interest in a vacuum. Let's say, for example, vacuum cleaner or a sheet of paper versus stuffed animals or dolls. And then the next one is deviant motor patterns may involve in the arms, hands, trunk, lower extremity, or entire body. So motor patterns in the upper extremities are common and include wiggling and flicking of the fingers, alternating flexion and extension of the fingers. So next one, disturbance of sensory and perceptual processing. So abnormal response to various visual, vestibular, and auditory stimuli. In particular, children with autism appear to be overly sensitive to sound and may have difficulty coping with everyday environmental noise. And also, associated impairments in autism include intellectual impairment, seizure disorder, and also discontinuities in developmental rates. All right, interventions for the ASD, autism spectrum disorder. So it's actually comprehensive interventions, including parental counseling, behavioral treatment, special education in highly structured environment, sensory integrative therapy, social skills, speech language therapy, and then family support constitute the best management for children with autism and the other types of PDD. So individuals with autism respond best to highly structured specialized educational program that includes element of communications therapy, social therapy, language therapy, sensory integration therapy. Okay, next let's talk about the Asperger syndrome. So Asperger syndrome, how we to differentiate with autism. So Asperger syndromes can be distinguished from autism by the fact that the students do not exhibit clinically delays in language skills, but others behavior or other speech almost the same as the autism, but in terms of language skills, uh, Asperger syndrome does not exhibit clinically significant delays. All right, what are the essential features of Asperger syndrome? So, severe and sustained impairment in social interactions and the development of restricted repetitive patterns of behavior, interests, and activities. So, this Asperger syndrome also have that obsessive interest in letters and numbers. Also, lack of non-verbal communications and of empathy. They tend to intellectualize feelings and show a poor understanding of others' affection. And then these Asperger syndromes show typical cognitive development and age appropriate. Individuals with Asperger syndrome display idiosyncrasies in verbal communication characterized by highly circumstantial utterance, long-winded and tangential accounts of events, failure to convey a clear thoughts of one-sidedness. So, what are the treatment for this Asperger syndrome? So, it consists of supportive and symptomatic interventions, almost the same as autism, and it includes special education programs, assistance generalizing adaptive functioning to a wider variety of settings, problem-solving strategies, social skill training, speech and language skill training, and also vocational training. All right, that's all for today. Thank you.